All right, folks, we are back with another solo episode. And as I was struggling and flipping and flopping about what to do the solo episode about, I went back to my YouTube channel to look for some inspiration. And it turns out that one of the topics that seems to really light everybody up is when I do a deep dive or a dive. I wouldn't call this a super deep dive, but when I do some kind of a dive or information episode on a peptide. I've been in this peptide space for a long time. I am not a doctor. As you know, I'm a holistic nutritionist. I'm a biohacker. I'm a podcast host. I talk to lots of people about peptides. I have a rather large community on Facebook that seems to come and go like the Cheshire cat these days. So some days it's up, some days it's not. And then I have a membership community on Circle called Longevity with Nat Niddam, where we have bigger conversations around peptides and other longevity strategies. And on that membership community, I started a second community for people who didn't want to deal with the ups, downs, and sideways of meta. And for $5 a month, they can be part of the Peptide Parlor, which is really just a small group of people who sit and talk about peptides. I support them, and I have a couple of admins who support them as well. Jennifer Matthews, who was my main admin on Facebook and got released off that platform a little while ago, is there as well supporting. So if you're looking to further this conversation, go a little bit deeper, then you can definitely join either of those communities. You can get that information on natniddam.com. But I'm going to talk today about one thymus peptide. This peptide is called Thymosin Alpha 1. Many of you will have heard of it. It is a naturally occurring thymus peptide. It's made up of 28 amino acids. So for those of you who come across different versions of Thymosin Alpha 1, always check. If people are doing research with peptides, always make sure that the right number of amino acids are there, because that's how you can sometimes tell if what you think you're getting is what you're getting. So Thymosin Alpha 1 is a naturally occurring thymus peptide. That means our thymus glands make or made Thymosin Alpha 1. There is a synthetic version of Thymosin Alpha 1 called Thymalphasin, and the brand name is called Zadaxin, and it is used in over 30 countries as a drug to treat both Hep B and C, although I think that's a little less common now, and also used as an immune enhancer and immune modulator. And I'm going to talk a little bit more about what that means in a little bit. What I've done is I've linked to a review study below for those of you who want to dig deeper and really want to dive into this and learn a lot more. The link to that paper is below. What I've done is I've kind of pulled out some of the kind of interesting things about Thymosin Alpha 1 so that if people want to research a little bit more, you have a good starting point and you have some knowledge. If you're going to look into using these compounds, you definitely, and especially with the thymus peptides, you really want to get support from a physician who's going to be able to coach you and make sure that this is going to work for you and not against you. The FDA has given orphan drug status to Zadaxin. Remember, that's the synthetic form of Thymosin Alpha 1. And it's used to treat melanoma. It was used to treat chronic active Hep B and also DiGeorge syndrome, but in a specific anomaly with immune defects, as well as hepatocellular carcinoma, which is a very fancy way of describing or naming the most common type of liver cancer. And the reason that it's used for all these different things and many more is because it has these immunomodulatory and anti-tumor effects. In terms of Hep B and C, it's largely been dropped because I gather there have been direct antiviral agents that have been identified, isolated, and produced to treat those. So, from what I could find in the literature I was looking at, once again, it is considered to exert immune modulating properties, and it modifies, enhances, and restores immune function, which is really, really interesting, right? So it's used for people who have immune compromised states. So that means their immune system's not working normally. Now, what I want to say here, for people who have deliberately suppressed immune system. So these are people who've had some kind of an organ transplant, or they're having some kind of a tissue graft where you're wanting the body to accept something that is not where it's supposed to be or didn't come from you. You would never, never, never touch Thymosin Alpha 1 because it could actually cause rejection right? Because if it's going to ramp up your immune system, you don't want that when you're trying to get the body to accept a new organ from a different place. So even though that may not be perfect and you don't want to have a suppressed immune system, you need it in order to take advantage of that new organ that's working for you. So big difference here. So people whose immune system's not working properly, possibly people whose immune system needs to be suppressed for those reasons, definitely positively no. All right. So make sure you take a note of that if you're listening for a friend or whatever the case may be. It has some really interesting applications in treating cancer, and I'm going to talk about that a little bit lower. And whatever it is, I'm about to step in a hornet's nest here, so I don't want to get into a political discussion about this. However, in elderly adults, one of the reasons why vaccines don't often work, and whatever vaccine this may be, and we're not getting into a discussion about vaccines, good, bad, or ugly, but in elderly people, their immune system very often is, a very non-technical way of describing it is that their immune system is tired. So it doesn't mount an immune response. And the whole point of a vaccine is to elicit an immune response for the body to produce antibodies so that when it comes across that pathogen later on, it has those memory cells ready to jump into action and fight. The problem is that when your immune system's kind of exhausted because you might be very old or for whatever reason, the vaccine doesn't work because your body doesn't your immune system just doesn't have the juice. Well, there were some really interesting studies that were done that showed that using Thymosin Alpha 1 as an adjuvant, as part of the vaccine or alongside the vaccine, helped the body to mount a proper immune response so that there was better effectiveness. So again, we're not arguing the benefits, the pros, the cons, the whole 9 yards of vaccines here. I'm just saying that in the event that one were to come across such a thing that they wanted to avail themselves of, and if we were dealing with an elderly population, this compound would be helpful. Also, it can be very helpful in managing sepsis, which is like a generalized infection. Sepsis is the kind of thing that actually kills people in hospitals, as well as many different types of infections. So there have been studies done in China in particular, where people with very severe sepsis that were admitted to the hospital were treated, at least in part, with Zadaxin and got really good results. Some of the very basic mechanisms of action, I'm not going to go deep on this. Once again, for those of you interested in going deep on the biochemistry and what cell populations are being ramped up, like natural killer cells or T cells or whatever the case may be, you can look at the paper. That link is going to be in the show notes for you. So you can kind of deep dive. And from that paper, you can then jump into a whole bunch of other papers as well. But basically, it prevents the excessive activation of T cells. So we know that one of the problems sometimes we encounter with infection is that the immune system kind of overreacts. Right? And so then we get into this spiral and things completely go sideways. So it modulates that response. It's not quite a bioregulator in that sense, because we know the bioregulators really keep things normal, but it definitely helps to manage and mitigate that overreaction. And interestingly, it has antibacterial, antiviral, and antifungal properties. Now, here's another little hornet's nest I'm going to step into, and I'm going to be careful because I don't want to get in trouble with the powers that be here. It was used in China during the time a few years ago when all the people were getting sick and ending up in the hospital, and they got really good results. They did studies in hospital that showed that people that were given Thymosin Alpha 1 were kept off respirators and had far better outcomes. So that was in a hospital setting. It was in very extreme times. And I think that those research papers are still around. Now, aside from that, it has shown benefit for other conditions such as psoriatic arthritis, general aging. Why? Because when we age, our immune system, like I said earlier, it doesn't respond as well. It's not as reactive. That's why you see more cancers as people get older, because their immune system is not as vigilant. The guys in the towers are getting a little sleepy. They're napping a little too much, so they miss stuff. So in aging, it can be very helpful. Also, in chemotherapy, it can help to decrease chemo-induced toxicity. So it's not used instead of chemo, but it can be used in certain clinical settings alongside chemo to help to mitigate the toxicity of the chemo on the healthy cells. Now, because it targets, I'm going to get a little technical here, but again, not going too deep, because it targets toll-like receptors, so TLR2 and TLR9, it actually can stimulate the adaptive immune response, which is what makes it helpful in fighting viral, bacterial, and fungal infections, as well as cancers. And of course, a lot of people will often talk about the link between viruses and cancers, which, hasn't been fully elucidated, but I think there's enough evidence there that we know that we don't want to be running around with a bunch of latent viruses just hanging out in the body, right? Another thing that's really interesting about Thymosin Alpha 1 is that it might be helpful for some people in dealing with mold toxicity. That means like you're in it, right? You're dealing with mold. You haven't quite figured out how to mitigate it in your home yet. What I would suggest if you're dealing with mold is I have some mold up in my bathroom, for example, and I have an air purifier right outside that bathroom that is running 24/7, just until I can get the tub pulled out and get the whole thing dealt with. The one that I use is called the Jasper. It's a great, great unit. If you've never heard of it before, I released a podcast episode with the founder of Jasper, who actually is a firefighter, and he developed this Jasper based on the scrubbers that they would use after fires. The Jasper is a very powerful, very effective way to mitigate mold. They've done studies that show that after 1 hour, it removes over 95% of mold spores, and after 2 hours, it's removed 100%. Really cool. In the meantime, one might have Thymosin Alpha 1 on board to help the body deal with the mold toxicity. Another type of cancer that it has been shown to be useful for, or it's being studied in breast cancer. It has shown to be effective against cell cultures of breast cancer. I'm not sure that clinical human studies have been done yet, but there's definitely signs that show that it has effectiveness against those cell lines. So I'm going to summarize all the different ways that this compound or this peptide, which, like I said earlier, it is naturally occurring. It naturally occurring in the human body. We don't have as much of it as we age. Our immune system starts to go down. But I'm just going to summarize for you some of the different methods of action. I think there's 9 things in this list. I'm going to keep this short. It's a little bit more dense than usual, but hopefully it'll give you guys some really good information and a nice jumping off point to learn more. So it's considered an immune system modulator. Now, I'm not sure I fully agree with this, because I know that what I've observed in my communities is that certain people who have certain types of imbalances in their immune system, and this is even people with autoimmune issues, if they go in too hot and heavy on a Thymosin Alpha 1, let's say their practitioner gives it to them and they don't listen to the take it low and slow instructions, they can throw themselves into a flare. It can over ramp the wrong side of the immune system. So definitely be cautious about that. But Thymosin Alpha 1 is a peptide that ultimately plays a central role in enhancing and regulating the immune system, which helps the body to defend against infections as well as maintain immune balance. It is useful for autoimmune conditions, but I would stress once again, if you've got an autoimmune condition going on, you're going to want to go really low, really slow if you and your provider decide that this is the way you want to go at this. It has demonstrated benefits in managing autoimmune diseases because it modulates that immune response and reduces excessive inflammation. And ultimately what this can do is it can help to alleviate symptoms as well as prevent tissue damage. It's also used to support cancer therapy, particularly, I'm just restating what I said earlier here, melanoma, lung, liver, and breast cancer, as well as a whole bunch of other ones. It's constantly being studied because it's approved as a drug in so many countries. And just because the FDA has only given it orphan status for a couple of conditions in the States, doesn't mean that there's not a whole lot of schools doing a whole lot of research and hospitals doing a whole lot of research on this. It is used as an adjunct in cancer treatment, particularly to enhance immune function during chemotherapy or radiation. Why? Because in chemotherapy and radiation, very often the immune system gets suppressed. It takes a beating. So if we can give the immune system kind of like a hand in keeping itself up, hopefully what we see is that on the other side of these therapies, people recover more quickly. And also it might help them to tolerate the therapies as well. It may even help the immune system to come back online a little faster after the therapies, because immune suppression, of course, we know is part of the problem when we have cancer growing in our bodies. The cancer cells are super smart. They have cloaking mechanisms. They kind of find a way not to be detected by the immune system. But if you, on top of that, have an immune system that's not vigilant, then you've got double trouble in play here. One of the big things about Thymosin Alpha 1 is that it is anti-inflammatory. I remember interviewing either Suzanne Ferre or Dr. Elizabeth Yurth, either Dr. Ferre or Dr. Yurth, or maybe both of them, talking about when they had patients coming in who were looking to lose a lot of weight. If they were overweight, when people are overweight, that fat tissue is secreting cytokines. These are inflammatory molecules. And so what they would do is they would, and I don't know if they still do this, this is going back a few years, but they would do is they would start their patients on a course of Thymosin Alpha 1 to help to mitigate that inflammation, to bring down the inflammation so that whatever they would apply after that would be more helpful. In today's days, where a lot of doctors are using GLPs with their patients, we know that the GLPs are actually themselves are anti-inflammatory, right? So managing inflammation is always going to be a piece of the puzzle. In fat loss, but it's also in many other diseases such as autoimmune disorders, heart disease, diabetes. We all know, we've all heard the term inflammaging as one of the 12 hallmarks of aging. So this is where earlier I said it was beneficial for aging, because again, if it can be beneficial in lowering inflammation over time, it's like you don't have that low grade fire burning all the time, throwing things out of whack. Also, and people don't really think of Thymosin Alpha 1 for this, but because it stimulates collagen production and skin cell repair, it actually can also be really helpful for wound healing and tissue repair. And we don't think of TA1 for that very often. Usually people will talk about BPC 157. They'll talk about thymosin beta 4, which by the way is another thymus peptide. They might talk about TB 500, which is a fragment of TB4. They might talk about GHK copper, but very often TA1 is not part of the equation. And if there's a lot of inflammation at play when somebody has whatever wound or whatever's going on, using Thymosin Alpha 1 as an agent to help to mitigate some of that inflammation might pave the way for the body to heal the wound more quickly. And this would be particularly after some kind of injury or post-surgery. It might be really helpful there as well. I mentioned earlier that it has antibacterial, antifungal, and antiviral properties. Again, you know what? I think because it's a thymus peptide, it's part of that whole adaptive immune response. It can be really helpful against all kinds of pathogens. And there's actually applications for Thymosin Alpha 1 in HIV patients. And that's, I think, really, really interesting and very relevant because of the next point I have for you here. And that is that it's been shown in those other countries where it gets used a lot to be very safe for long-term use. Clinical studies indicate that Thymosin Alpha 1 is generally safe for long-term use in most people with mild and manageable side effects reported. So those would typically be, very often when people talk about side effects with peptides, very often it's that whole site injection irritation. And that brings up the next point, which is how do we use Thymosin Alpha 1, right? So how it's used is by subcutaneous injection. That's usually using a small insulin needle, and you would be provided by your physician with your vial of Thymosin Alpha 1 or Zadaxin and an insulin needle. You might get an injection pen that they could preload for you and then set that dose ahead of time so that all you have to do is kind of change the little tip and apply the pen and you're good to go. Now, one other really cool benefit or one cool pathway by which it is so helpful is that it also offers antioxidant protection. So it increases antioxidant enzyme activity. So notice I didn't say it's not an antioxidant itself. What it does is it bumps up your own body's activity of antioxidant enzymes, and that helps to protect tissues from oxidative damage and supports overall cellular health. That's kind of the long and the short of TA1. And one of the reasons why I've always hesitated doing too many of these peptide deep dives is because I don't want to be the one sitting here telling you to run out and do something that is not on the up and up. It is definitely in a gray zone. Like I said, it is not widely approved for human use yet. So if you have something going on and this is something that you want to explore, then I would highly encourage you to find yourself a physician or a practitioner who can walk with you and really figure out, is this the right thing for you? It sounds like a magical solution to a lot of different things. It can be wildly helpful in a lot of different situations, but I would say that I've also seen it backfire on people in the wrong situations. I've seen people who are very sensitive to compounds, whose immune system is kind of all over the place. And I've seen them get really excited about Thymosin Alpha 1, apply it and get thrown for a loop. So it can happen. Anybody who tells you that there's no risk and there's no problem with any of these peptides because they're endogenous compounds, blah, 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 is either trying to sell you something or they're not fully informed. All right. So you want to be careful out there. You want to be mindful and you want to get educated. Do your homework before you start introducing any of these things into your body. And definitely in all cases, make sure that you consult with a physician or a practitioner. The numbers of these people is growing by the day, right? There's my good friend, Dr. Melissa Peterson, who runs the Human Longevity Institute. She has a peptide university in there where she's educating physicians. There's doctors Lee and Rodriguez, who have another organization. There's A4M, which does physician education as well. And those are just three. There's scores more of education streams for physicians who want to get up to speed on these things. So definitely there's more and more physicians out there using these compounds. So if you've got something going on and you think that this might be something that would be helpful for you, especially if you're dealing with a cancer like a melanoma or breast cancer or whatever, you definitely want to find yourself a physician who's versed in these compounds and can figure out where it might fit in and how it might be helpful. Okay. So I would be remiss if I didn't give a small shout to a new app that's out on the market that I am really impressed with, particularly for people who want to take matters into their own hands. It's called Peptide Pro. The URL for it is peptidepro.app. We have a code for you guys, Nathalie 50. And that's NATHALIE 50. That's 50% off your first month subscription if you want to just check it out. Or if you're ready to jump in with both feet and get a year, then it's Nathalie 10, same spelling on Nathalie with the number 10. And in that app, what you will find is an encyclopedia of 65 plus peptides. There's a calculator, there's a calendar, there's suggested or starting protocols with stacks of compounds. So these are things that you can kind of review with your practitioner and make sure that it's going to be right for you. So thank you so much for being here today. I hope that you found this educational and useful. Let me know if you want more of these little pep talks from Nat, and I'll be happy to oblige. And make sure you sign up for my newsletter. All right. There's the full big giant newsletter that comes out on Sundays. And then there's also a peptide specific newsletter. We're just ramping it up. Get on that list because we'll be giving you little tidbits of information on different peptides every week. Haven't quite decided what day it'll come out yet. Maybe on Wednesdays, just to get it away from the Sunday and keep the education flowing. Thank you so much, folks. Always a pleasure to see you. I mean, I'm not really seeing you, but you're seeing me. Always a pleasure to spend time with you. Let me know what you think and what else you want to learn about.